When the time comes to deliver your baby, there are many possible positions you can be in. You will most likely change positions a lot during labor. One position might only work for a little while, offering brief relief before becoming unbearable, so knowing a few ahead of time so that you can try and pick one that is best for you really helps. Let's have a look at some of the different positions you can be in during labor.
This is the movie position that everyone imagines themselves in. It is very common and might be right in your situation, however, it is not always the best option. This is because it can make your contractions more painful and your labor longer because you aren't using gravity to help the baby out. This can make an epidural more likely. If you choose to have an epidural early on in your labor, this is the position that you will most likely be in, as you cannot walk around or stand once you've had one. Although this may sound uncomfortable, the standing position has lots of benefits for the labor process. This is because you are working with gravity, which helps the baby's descent as it opens your pelvis. You can also be distracted from the pain in this position with the constant movement and change in surroundings. However, the strength of contractions can sometimes be increased when walking, and this position is not advised when you are actually pushing, as you will have less control. Squatting is a position that is becoming more common. This can actually help open up your pelvis up to 28% more than in the semi-sitting position, which makes the process of labor easier. It is also less painful than lying down, and again you are working with gravity to help the baby out. Squatting decreases the need for forceps and is also a good position for pushing. While this position may look strange, some women say it just feels right to be in this position during the labor process. It can help relieve pain in the lower back and helps open up the pelvis. It is also a good position for pushing as you are working with gravity. Lying on your side is a less active position, but it is a good one to rest in and conserve your energy when possible. This is a good position to help your blood flow and can be used when you've had an epidural. It's a good idea to lie on your side if birth is moving too fast and you need to slow things down. This can also lower the chance of tearing. However, you are not working with gravity when you are in this position, so it is not recommended to lie on your side if your labor is not progressing. Sitting can be used effectively both for resting and for pain management. Being in this position also helps the baby's descent through the birth canal. However, this is not a good position for pushing as it restricts access to the perineum.
The positions you use may be influenced by the pain management method you choose, so chat to your gynae, midwife or doula about your options ahead of time.